Hi, this is Kevin Diekhaus. I'm the head of infectious diseases at Yukon Health, and I wanted to show you a few things that we're doing in southwestern Uganda. This has been a particularly exciting rotation for a number of residents and students and fellows. So I started going to Uganda in 2003, and initially started in the capital, but eventually found myself in the southwestern corner of the country. We have a number of types of experiences that we are able to accomplish with our learners, including for fellows and residents, typically a clinical experience. And this is focused on tropical medicine and in a clinically under-resourced area. We provide about 2 months of coverage every year at St. Francis Mutulari Hospital, and I'll show you a picture of that in just a little bit. And we bring internal medicine residents, ID fellows, and senior medical students to help with the clinical programs. We also do a fair bit of public health experiences, primarily under research, and this is focused on the medical students, although we have had fellows, we've had medical residents participate in this portion of the program as well. And to date, I've been able to bring 79 learners, a combination of medical students, medical residents, and ID fellows. And we've had the help of a number of Yukon faculty members as well, who go back on an occasional basis to help supervise and lead trips to Uganda. So where is Uganda? Well, it's right in the middle of Africa. Some would call it East Africa. Technically, it's right in the middle, though, and we're down in the southwestern corner. So if you look at the country, the capital is in Kampala. One is able to fly into Kampala, but if you drive all the way down to Kasoro district, that takes you about 8 to 10 hours of a drive. So we actually fly in through Rwanda and drive north and cross the border right into Kasoro district from there. And that's about a 3-hour drive. So this is Kasoro district. It's pretty rural. This is Mount Muhabura in the background and looking south. So behind that mountain is Rwanda. And if you look to the right, there's a mountain chain that extends, and that mountain chain delineates between Rwanda and Congo, and Uganda and Congo. So we're basically right in that little corner in the southwest corner of Uganda. It's very rural, very hilly, very beautiful area. It is one of the poorest and least developed districts of Uganda, and it's very densely populated, despite being rural. The population is fairly intense for the amount of land surface area, so this is intensely farmed all the way up and down the hills. Literacy rate is pretty low. National rate is 54%. Kasoro is typically one, I would say, standard deviation lower than the normal in terms of socioeconomic status compared to the rest of Uganda in general. And there's a very large impact of subsistence level farming. So this is volcanic soil. It's very difficult to get machinery in here because of the slope of the hills, and a lot of this farming has to be done entirely by hand. So it's a lot of manual labor. This is the hospital that we work at. It's St. Francis Mutulari Hospital, nestled in Kasoro district, and you can see the mountain chain in the background. To the right again is Congo, and behind that would be Rwanda. It's a 210-bed hospital that serves about 10,000 admissions a year, and it has all the services that you'd expect for a mission hospital, including the OB, surgical, pediatric, and medical units. There's an outpatient clinic that will spend time in public health and immunizations, and then really interesting when we were able to do outreach programs, typically up into the northern part of the district where the African pygmy or Batwa population is located. So joining the wards, we'll usually head in every morning. There's a series of rooms that are marked out for female wards and male wards and the tuberculosis wards. So as we go in, we meet Sister Beria. This is our team from recently, and they often greet us. They know we're coming, and they enjoy having their American friends help out. So we go bed to bed. You can see it's fairly cramped quarters. We'll send a student or resident ahead to pre-round on a patient. We do work with local translators because the local language of Rufumbira is a little challenging for us English speakers to be able to use. We are able to say some phonetic, medically oriented things, such as sit up, take a deep breath, open your mouth, that sort of thing. But when it gets more complicated, we need to have translator help. So we'll work through the wards, kind of talking case by case. Very heavy influence of tropical medicine and infectious diseases with the types of patients that we see. It is very rural, occasional chicken walking through. So the types of things that we'll see, again, heavy influence of infectious diseases. So a lot of malaria, HIV/AIDS, diarrhea, and skin diseases, and parasites, particularly Ascaris, pneumonias and soft tissue infections, sepsis. We do see typhoid, tuberculosis, and then a number of what I call U.S.-based diseases, but in a tropical medicine format. So diabetes and stroke and hypertension. Another infectious disease that we see a fair bit of is brucellosis, which we don't see much in the U.S., but is fairly common in this area. The separate project is the Clarinesenga Clinic, and this is a 501c3 that myself and a few colleagues organized back in 2003 to 2004. We opened a clinic in 2006, and this is a rural clinic right on the border with Rwanda. This serves a little 8-village community. We started as the level 1 health facility, so basically a walk-in clinic. It sees a large number of patients for very localized kind of walk-in type problems. So malaria is pretty seasonal. So when there's a malaria epidemic going on, there's a heavy influence of malaria. Respiratory infections, dysentery, worms, skin diseases, UTIs, STDs, you name it. There's a lot of infectious diseases associated, and a lot of primary care. We do pediatric immunizations for children as well. And this serves as the center of some of our outreach organizations. So our programs will often work out of St. Francis Montpelier Hospital, but they're really working in the area around Clarinesenga Health Clinic. We opened a maternity ward with fundraising from the United States, and this is our first baby. She was actually born on Mother's Day in 2018. So what's the weekly work plan? So Monday morning we have an administrative meeting. We talk about cases that are of interest to the surgeons and the obstetrics people and the medicine doctors. Monday, Wednesday, Friday we have major rounds, which means we see everybody, walk through usually through female and then male medical wards. Tuesday, Thursday, and Saturday we'll do minor rounds, which is seeing new admissions, people that the nurses will point out as having issues. Usually on Tuesday, Thursday we see everyone regardless. Weekends we scale that back a bit. There is a tropical medicine lecture series that we do, usually at dinner. So this is dinner augmented by our favorite beverages, and we talk about tropical medicine issues, cases, local culture, and history. We're also introduced ultrasound skills. So we have a IQ butterfly, and we have lots of opportunity to use that. So we'll be able to look at cardiac outcomes. And so, for example, this is a patient who had an unclear volume status, and we were able to determine was volume overloaded. So having that was very helpful to be able to allow treatment. And then a woman with cirrhosis to help with some of our procedures. We do procedures, so paracenteses and thoracenteses are used with the help of the ultrasound, and we'll do lumbar punctures as well. There's a laboratory immersion, so there's a curriculum that's provided on things like parasitology, oven parasites, acid-fast bacilli, and staining. Malaria, you'll see lots of malaria, as well as some serologies. And usually these are point-of-care serologies like RPRs and brucella tests. And then there's a self-directed reading in cases that are given by USB drive that one would read in the evening. And it you follow along with the curriculum on that. So this is the 4-week schedule and curriculum. I won't get into too much detail, but it goes through a number of the infectious diseases and tropical medicine type issues that you would see, as well as some of the social and cultural issues. Now, what can you do aside from the medicine? Well, this is an area that's fairly traveled by 2 types of people. One would be healthcare workers, and the other is visitors going to see the mountain gorillas. This is one of the few areas in the world where mountain gorillas are located. Again, nestled right in the Congolese, Rwandan, Ugandan border. You can go to the south at Mugahinga Park, or to the north in the Bwindi Impenetrable Forest, and you can see why it gets that name. So these are the mountain gorillas. You can actually get fairly close. So this is Dr. Bielik with her friend, the mountain gorilla. So you get to spend about an hour watching mountain gorillas do what mountain gorillas do, and then you hike back. It's a nice hike as well. Other things you can potentially do is we usually do a weekend trip and head and go see kind of typical safari animals at Queen Elizabeth Park. The equator is right there. Or you can go mountain climbing. And so this is the Virunga Range. I have climbed all 3 of the mountains between Uganda and Rwanda. So this is Mount Muhabura, Mugahinga, and Sabinyo in the forefront, and those serve as the border between Rwanda and Uganda. We can take it easy also by heading to the lake. Lake Mutanda is a nice place to hang out. So if Uganda is not your thing, there are some other opportunities. So this is a map just showing several of the places that one might consider for opportunities. We have a number of relationships in the Caribbean, in Central America, and South America. There's the Ugandan program that I was just talking about. We have relationships in India as well as on Guam, and more recently a new relationship opening up in Vietnam. So that's an overview of the international programs that we run at UConn Infectious Disease Fellowship. Most of the fellows over the course of 2 years will spend some time with me in Uganda. It is optional, but I would encourage you to talk with me about options, and we'll see what you're interested in doing and find a path for you. Thanks so much.